Dr. Kyle with Project Wellness Company, and what we want to talk about is your posture when you're sitting at your workstation and what can happen if we have really poor posture, especially to our low back, okay? And so all too often when we're sitting at our workstation, and because we've transitioned to more being at home, it's even more vitally important to make sure that that is correct. And so what happens all too often is we get a rounding in that shoulder and that head starts to pull forward. And what happens is for every inch that your posture, your head is slid forward from your shoulders, that's going to add up to 100 pounds or more of pressure to your discs in your low back. Okay, because if we're sitting like this all day long, you're going to notice that she has way more rounding in her thoracic spine or her mid back here than what she should. And then as well, what that does to the low back, it kind of flattens it out where there should be a curve in that low back. And so if she sits back up where she's supposed to be in her good posture, you're going to notice that that rounding goes away and the curving in her low back comes back to where it's supposed to be, which this is the ideal position for the low back and the spine when we're sitting, working, whether it be at a computer or something of that extent. But if we have somebody coming in with low back issues and they sit a lot, okay, this is typically what we're dealing with. And so structurally, we need to get more mobility in the low back, in the mid back here. But then in the low back, if they're having pain down into here, all too often it's going to be kind of right at that belt line. So right across here, and even sometimes if it's even more severe, we're going to get radiation of pain that's going down those legs. And so it could be sharp shooting, tingling. It could go, just from that low back into the glutes. It could stay focalized right here, or it could even travel down into those legs. And if it's anything that's like numbness, tingling, sharp type pains, there's going to be a nerve involvement there. We just need to figure out, is it disc involvement, is it vertebrae involvement, or is it the hips themselves, which would be the bones that she's actually sitting on right here, causing that pressure on those nerves, okay? And so one of the easiest ways to evaluate that is I'm going to have her lay back down here for us. So as she's laying here, visually, a couple of things that I like to evaluate for is if her hips are rotated, meaning like they're shifted this way or rocking front to back here, you visually would be able to see that the hips are rotated here. Okay, that's one way to check. Another way would be to come down here and I'll reset her hips. I'll maybe push out of my hands and relax. What I want to look for, so I want to look to see is if her feet are level. Okay, and when I'm looking at hers here, we're going to notice that her right leg is about a ½ inch shorter than her left. And so we go and bring that on up, and we're going to notice that they go even. So that lets me know that we have an issue up in her pelvis that would be contributing or potentially causing that low back discomfort that she's having, that sharp shooting pain that's coming down into those legs. Now another check that I like to do is more of a motion palpation. So we come in here and just apply a little bit of pressure. Okay, once again, these bones should move as I push against them. And I notice when I'm coming in here is her right hip is fixated. Okay, so it's subluxated, and that was the same leg that was having the issues. Okay, so that's going to rule in and rule out whether or not we have SI or hip involvement here. Now, once I figured that out, I want to check to see if the individual vertebrae in that low back are causing some of those issues as well. And so what we want to do is we want to come in here and challenge those joints from left to right. Okay, now if those bones are freely moving, they should move slightly left and right. And the other thing too is I always confirm this with the patient, is I want to look to see, is it tender? Okay, because if we're having an SI involvement on the right side here, more than likely I'm going to have a lumbar that's also having an issue as well. And so when I come in here and I motion left to right, she's going to let us know that when I push in on that right side here, she has some tenderness. Am I right on that? Mm-hmm. Okay. Left side wasn't too bad. And I work my way all the way up those lumbar spine just to confirm that we're not having issues anywhere else. Now, if I felt like she was having a disc issue in her low back, typically she's going to present where if she bends forward slightly, it's going to feel a little bit better. If she goes back into extension, it's going to hurt worse. And so what we want to do is we want to look to see if there's disc involvement. The other thing too is she may have a lean slightly to one side, taking pressure off of that disc. And so how we check that is that have you bend your knee for me? And what I'm looking for here is I'm looking for her to be able to hold my pressure. So if I ask her to hold here, you're going to notice that her foot's able to lock out my pressure. Okay, and so what I would do is I'd come into her lumbar spine here. I'd go on the left and the right where those discs are lying, applying a little pressure, and I'll have her resist me. Okay, and we'll work our way all the way up the spine looking for any type of issues with those discs as we're going through that lumbar spine, checking to see if we have disc involvement as well with that low back, which would be potentially causing that radiation of pain down in the legs. Now, if I find that we have a disc, you can relax. If I find that we have a disc involvement, okay, there's a lot more work that needs to be done on a structural standpoint in order to get her low back pain to go away, because we have discs that are involved, we have bones that are subluxated, so there's multiple facets of things that we need to do in order to get this to calm back down. And then as well, her at-home exercise, if it's disc involvement, there's going to be specific exercises that I ask her to do on a daily basis, multiple times a day, in order to help to push the discs essentially where they're supposed to be, getting them back in a position that's normal for them, ultimately taking pressure off that nerves, working to get rid of that shooting pain, the numbness, tingling going down those legs. And so for her, we found that she had an issue on her right. She had no disc involvement. So we have an issue here and up in that lumbar spine right here. So what I'm going to ask her to do is I'll have you lay on your left side for me. And so then what I'm going to do is I'm going to come up and I'm going to adjust the lumbar spine first. Okay, so we get her into position here. Apply some contact right there. I'll have her take a nice deep breath in and let it all the way out. Okay. And then I'll have her go ahead and change the other side so we can address that right SI. Then what I'll have her do is going back to your stomach for me. Now what I want to do is I want to confirm with that leg check. Remember me letting you know that that right one was short. Okay, so I'll have her reset her hips again. So I'll have her push out on my hands and we'll go and relax. And so that when I go and look at her feet, now they're perfectly level. Whereas we had that half-inch difference from left to right. So that lets me know that I've cleared that right SI out. And so then what we'll do is we'll motion them out. We're going to see that now that it's moving, which is what we want to see. Okay. Now, on a technique standpoint, the one that I just did was Gonstead. Okay, so it's the side posture. There's other ways to adjust her low back. We could use the drops where the table comes up and then eventually it will fall. And so I would use the table to adjust her spine, which is a lighter technique in order to accomplish the same thing. There's another technique we could use, which is an activator, which is a pinpoint adjustment in order to get these bones to specifically move. So there's a lot of different tools that we use on a day-to-day basis to address certain issues. And some patients are going to respond better to side posture, some do better with drops, some do better with activator. And so a lot of that is done through the initial process of getting to know the patient, what they have going on, evaluating their x-rays, seeing specifically what techniques would work the best in order to get the results that we want, ultimately get her back playing and doing the things that she likes to do, sitting at her desk working and not having the pains that she's currently dealing with.